Welcome to the Centurion's Path, a podcast about the life and the trials and tribulations of those who serve. This podcast is about the heroes who protect our communities. To truly understand the path of the protector, tune in with AJ D'Andrea and John McDonald, two nationally known leaders who live the Centurion's Path every day.
Thank you all for joining us today. To our sponsor for today's podcast, Safe Haven Defense. Preserving property, protecting lives, providing peace of mind. Hi, everybody. Welcome to episode 16 of the Centurion's Path podcast. Excited to be back with my co-host, AJ D'Andrea. It's been a while since I've caught up with you.
Yeah. How's life going, buddy?
You know, it's all right. I was expected to head to Maui tomorrow for 2 weeks on the beach. And my wife now has pneumonia. So she can't travel, and we're going to just quietly shut down our vacation and take a couple days and get her better, and then we'll figure out another time to go on vacation. So, I've just been traveling.
Yeah. One thing, Maui's always going to be there. So
right,
get her healthy, and that way you guys can go and truly enjoy it. But
yeah, exactly.
What else? You've been busy?
I was up in Ohio working, and then got stuck up there. All the tornadoes in Missouri and Texas and Oklahoma shut down travel, so I ended up having to drive from Cincinnati back to Springfield, Missouri, which was a good 10-hour drive, so that was fun.
We drove that same road together last spring. Yeah,
we did. Yeah, I thought about it.
From not far from Springfield.
Really? Where are you from?
Joplin.
Okay.
Very cool.
Very cool. Well, how about you? I know you've been setting the world on fire.
I've been busy. I mean, it's just been from, the tactical classes to the lectures to some of the consulting. It's just been really busy. I think, I don't know, Boston, North Carolina, Indiana, Canada. And I think I've got maybe 5 or 6 trips, one down to see you in December. But yeah, I think I got 5 or 6 trips before the end of the year. So it's busy. And then life, throwing some cattle on the property here this weekend, I think. And so busy things here as well. So it's, no rest for the wicked for sure.
It's tough to be in demand.
Yeah, right.
Yeah. Tough to be good looking, tough to be in demand. You've got a heck of a life.
I would know nothing about any of that. Right? So anyway, listen, we are so excited to have our guests here. We have Lieutenant Derek Gutzweiler from Summit County. Amy Fry is a clinician, and Holly Williams is a case manager. And we're going to talk a little bit about their mental health response that they're working on up there and some of the other things that are going on. But again, welcome to the show. We are very excited. Been trying to get this figured out and get you guys on. We've been talking about it for a couple months, and I'm glad it finally all came together to be able to get you guys on. So I'm going to let you guys introduce yourself, even though I just did that, so our listeners and the viewers that actually watch this know who can put a sound to a face. So,
sure, I'll kick that off. First of all, thank you guys so much for having us today. It's really our honor to get to speak with you. We're very passionate about mental health response in our community. My name is Lieutenant Derek Gutzweiler. I've been with the Summit County Sheriff's Office for 20 years. And for the last 5, I've been the director for the Summit County SMART program. That's the system-wide mental assessment response team.
Very cool. And who wants to go next?
I'll jump in. My name is Andy Fry. I'm a clinician with the Summit County Sheriff's Office SMART program. I'm a licensed social worker and clinical trauma professional certified and certified addictions technician. My background has been in mental health agencies throughout the community. I've been here in Summit County for about 15 years now, and have been with the Sheriff's Office for a few years.
Very cool. And from Joplin, Missouri, which is close to where John's at, right?
Oh,
it's kind of cool. And Holly.
My name's Holly Williams. I'm a case manager with the SMART program, and I've been here for just over a year now. So I'm one of the new ones, and I'm just really excited and passionate to be working in this field now.
Very cool. So tell us a little bit about how you guys are, how you guys function. What is, we don't got to get in. Yeah, just kind of tell us how you function and kind of some of the stuff that you're doing and what you're seeing that's working and some of the obstacles you guys might be dealing with.
That's a big question. But yeah, to maybe give you an overview of some of the work that we do. We run 2 programs, one of which is a co-responder program. Just for those that may not be familiar with what co-response is, that's where a police officer partners with a mental health professional. And I kind of think of it in the same way that I think of other resources that are coming out of dispatch, right? If you have a fire, you call for the fire department. If you call for a medical emergency, you're calling EMS. This is another kind of response where we can send a mental health professional right to the person in their moment of crisis, wherever that's happening at. So in the same way that our dispatch center might just send a police officer, we can send a higher level trained professional right to the person and start to work with them, assess them, and get them the help they might need. And then the second part of the program is through intensive case management. If the co-responder program is the doc in the ER, working with the person that just had an accident, getting them through for a couple days, throwing a Band-Aid on until we can get them stabilized. The case managers work with people for days, weeks, months, or years. As long as they have a mental health goal that they can work towards, that case manager's going to be working with that person just continually to make them have long-term recovery and have the best outcomes. And they mitigate all kind of barriers to treatment, whether that's cost or finding somebody within an insurance network. Really, one of the things I think that they're an unsung hero in is navigation of these systems is hard. And if you can imagine having severe schizophrenia and trying to fill out an insurance application, getting a Vita Statistics, birth certificate, a driver's license, all those things that you have to get care, it would be very difficult. The case manager can be that person's connection point and kind of their assistant in getting going in some of these treatments that we help people to connect with.
Are you seeing a reduction, a market reduction, or just, I guess, in terms of when you approach people in the community on a call and you're bringing a co-responder with you, of reduction in jail time and arrests, increase in mental health holds? What are you finding?
Yes, so we work through least restrictive means. We do our best not to place people on mental health holds. And I could talk a little further on this in a moment, but what we try to do is stabilize people in the community. Instead of taking somebody to an emergency room, and you got to kind of think of it like this, right? You're assessing someone, they reach a threshold that they need assistance. And then we, the police officers, say the level of assistance you need is for me to write a hold on you where you can't leave the hospital for 3 days. And then they get put into an emergency room. In most places, the emergency room is not treating them. They're actually waiting for bed space to open somewhere else. And then that person is transported for treatment after 3 days or after however long it takes to get bed space. Well, as all that's happening, people are racking up a hospital bill. There's ambulance costs associated with that. You got to think about other patients in the emergency room. Like if there's a child with a broken arm right next to a person with severe psychiatric distress, it's very disruptive for the emergency room. So we think that's not the best place for someone that is having a mental health crisis. The kind of work that we do is we go there and make to the scene wherever a mental health crisis is happening. Andy can talk a little more about this, but they do a higher level mental health assessment, something much higher than what you and I and most cops are trained to do. And then from that assessment, it really drives what happens next. Everybody gets an individualized plan. But when I say stabilized in place, what I mean is we put supports back in place. So if they were at the threshold for a mental health hold, we try to cool that temperature to a place where they can be safe. And then we complete something called a safety plan and a lethal means restriction with those clients. A safety plan might look like, hey, would it be okay if you stayed with your mom tonight at her house? If we can make sure that it's a safe environment. And then we have an appointment waiting for you at 9 a.m. tomorrow in the community without holding someone against their will. This isn't for every single case, but our stabilization rate is actually 90% of our calls.
Wow.
So we did 1,100 mental health assessments last year, and 92% of those were stabilized in place.
That's fantastic.
Yeah. So it saved. I've done a cost analysis in our community on what a mental health crisis costs. It's about $30,000 an occurrence if we talk about every single person and place they touch. And some of that's absorbed by the person in crisis, some of it by first responders. Our response costs around $600 a response, and that includes several follow-up appointments after the crisis with a community mental health professional.
That's
Wow,
amazing.
what a difference.
Yeah. Are you seeing, is it reducing the perpetual call for service for the individual? Because I know that like in the community, we have those individuals that are in crisis, they start to stabilize, they're back in crisis. Is it reducing that perpetual call for service on those individuals? Are you seeing some success in that?
I think a great person to speak about this is Holly in our high utilization populations and how that all works.
Yeah, I think it definitely does. That's where the case management piece, I think, really makes our program very robust. We have 4 case managers currently, and it just gives us that touch point. We follow up with them at least weekly at a minimum, and can really check in before they hit that next crisis point, which I think is crucial to keeping people off those crisis calls.
Well, that's pretty cool. And then Andy, are you, as a clinician, so I'm assuming you're the one that's going out on scene, and are you
correct.
riding with a deputy? Do you go out there by yourself? Tell me how that whole process kind of goes for you guys.
Absolutely. So the way our program model is set up, we are paired as teams with a clinician and a technician deputy. All of the technician deputies that work with the clinicians are specialized to this unit. They only work with SMART. They may have backgrounds in patrol and other types of law enforcement, but they are dedicated strictly to our mental health response team. So generally a clinician is paired up with another technician. When we receive a call for service from dispatch, we will go out together riding in an unmarked vehicle. We're in plain clothes. We do wear body armor vests inconspicuously underneath our clothing, but we try to be as discreet as possible and respectful to the individual and not draw attention to their crisis. And so we respond to numerous types of calls. I mean, really anything that has some type of mental health component to it, we can respond to. And that could be anything from suicide attempts or threats to welfare checks. It's not uncommon for us to respond following a dispute or a motor vehicle accident. I mean, really, there's so many things that would involve emergency services that could lead to someone being in crisis. So we might go out there to supplement patrol deputies. Sometimes we're able to totally replace them and go out as an alternative to uniformed officers responding.
And so the officers are in plain clothes as well?
They are.
Yes, their deputy technicians wear plain clothes. They'll have their duty belt on, but the rest of their attire is just kind of your general day-to-day look like you're dressed currently.
Yeah, so totally that calming effect rather than having this person in crisis, and now you're looking at somebody in a uniform and a squad car out in front of the house and all of that. So
I think one thing that's interesting about that is, like, you would think people are just interested in talking to the clinician about their mental health concerns. But after our teams contacted people a couple of times, they're calling the office looking for the police officer also to talk with him.
Nice.
So it's kind of a different way of, I don't know. I just wouldn't have thought that would have been the way that worked out.
Does this model lend itself to this type of community that you're living in? I mean, does the community make a difference whether this model works or not?
Yes, so we have about 300 community partners that we partner with.
Okay.
One of Holly's specializations in case management is they go out into the community and they actually map all of the resources that exist in your community.
Wow.
Then they also map all the criteria for each of those programs and treatments so that we know how to get people into those types of programs. And then we also have this relationship piece where we don't just do that once. Every single week, we have one community partner come to us. We present what our program does to them, and they present what their program does to us. And then we have this mutually beneficial relationship. And so I wouldn't expect a private practice therapist to have to provide secure transport from their office to a hospital for one of their patients, or going hands-on with somebody to get them there safely. So those community partners will reach out to us whenever that's beneficial and good for the client too. And we'll make sure that the person gets to where they need to go safely. But if I need an appointment for somebody and I need it tomorrow, I don't know if you guys know the way that mental health appointments work. Usually, even when you're in crisis, mental health appointments 2 weeks out. And I don't think that's a great system. Yeah. But if I call one of these community partners and I say, hey, I have an emergency, I need help, they're very willing to help us because we've created those relationships. That's a big part of some of the stuff that Holly does too.
And if I could speak to like the population here in our community and the clients we serve, I think that kind of ties into everything Guts was just explaining about our partners. Summit County is a really unique environment and unique culture here.
Yeah.
We are a mountain town, a ski resort community. It's relatively remote, but still accessible to some of the bigger cities in Colorado or along the I-70 corridor. So, I mean, when you look at the actual general population of Summit County, there's this small portion that is the local year-round residents, but on a day-to-day basis, especially in the winter season, I mean, there's numerous tourists and visitors, second homeowners, folks that are just kind of passing through to wherever their destination is. We have, transient folks that end up unhoused that are in this community. It's, we have long, tough winters and a high cost of living. It's a lot of seasonal workers that come out too. And it's not uncommon for that to connect to someone finding themselves in a struggle, whether it be through any of those aspects of their life where they might find themselves in crisis.
Yeah. How,
go
ahead.
I was just going to say it's a fascinating model. And I just think, the time I started my career when none of this existed and nobody even thought of anything like this to where you're at today and the type of work that you're doing. And to me, it's just an indication of the professionalization of the industry and the commitment to, protecting community in a different way than we ever thought possible.
Well, exactly. Right. And you've seen this evolution. And it is a hot topic conversation, right? Is this a law enforcement response? Is it a medical response? Should it be a fire response? But it sounds like you guys are working through that quite well. How does fire play into this at all? Are they, sure. I know at Arvada that our fire department had their own clinicians and there was a pressure point on who should be doing what and how do we bring this together. And at times it was frustrating for me, right? Because we have, people that create things that have their silos and they don't want to share. But how is that working for you guys between those two entities, between yourself and what fire may or may want to do?
Well, from a clinical standpoint, I feel very strongly that having a co-responder model that pairs a clinician with a law enforcement officer is the most effective model. I mean, I've done a lot of research into other types of programs that are throughout Colorado where a clinician might be paired with an EMT or with fire personnel, or sometimes their agencies blend a blend of both. And I think the big barrier with that is if there's some type of law concern or safety concern that really limits the amount of calls that they're able to respond to, or they then still have to supplement their service with calling out law enforcement in addition to that, whereas we can just go out and we don't have that barrier to us. You know, we can respond when folks are highly escalated or potentially dangerous, you know, or if someone has some type of weapon on them, we have a lot more range of things that we can go to because of that law enforcement partnership with us. And I think having the clinician integrated into law enforcement versus contracting out with community mental health agencies is another huge benefit to our team and its success. All of our clinicians, again, they're blended into the law enforcement culture here. We do trainings together. We have been trained extensively on various things about how to respond safely when you're approaching a person or arriving on scene, and working the radio and just all the things to be aware of safety wise when you're responding. And I think that's something that's really severely lacking in other types of models because they don't have law enforcement present.
Right. Yeah, and they can be volatile calls. I mean, the goal is to get there and calm it down, right? But they can be extremely volatile. But so you guys are navigating those waters quite well, it sounds like.
I think the other part of it is when we designed this program, we brought them to the table, honestly, AJ.
Yeah.
And
knowing you, I'm sure you did.
Now, are the clinicians, are they employed by the police department? Are they contract?
Yes.
Yeah, they're all sworn members of our sheriff's office.
Nice.
As are the case managers.
Very cool. But I cut you off, Guts. What were you were saying? You brought.
I was just going to say, I think you're right on. There is always that. This is my part. This is your part. Don't go into my territory. But bringing those guys in at the beginning of the inception of our program and letting them have a seat at the table. We help them write a protocol, which those guys love protocols.
Yes.
We helped them write a protocol, and they had ownership of it. And I think that was very helpful with us in delineating some of those relationships early on and how things worked. And, I will say this too, like, I think anytime something new happens in law enforcement, we're creatures of habit, police officers are. And so there's going to be some resistance. And I'll be honest with you, when we first launched our program, I'm sure it's the same as any other locale in the United States. When we tried to make something new, there was some resistance. And people were like, why are you sending a social worker to go in and do my job, or a professional counselor to do my work? But now, after a very short period of time, we worked hard in our community to educate not only our community partners, but our law enforcement partners. We go there and do trainings at each one of our police departments. We're multi-jurisdictional, so we take care of all of Summit County, 630 square miles, in every city within it. And so we had to go and kind of explain to the police officers what it is that we're doing and how we're used and why it's a good idea. And after we did good work in the community for a little while, law enforcement really saw the value of it. And now police, fire, EMS, they all call us whenever they have any type of call where they're like, I think you could talk to a professional right now.
Yeah. Well, the proof is in the pudding, right? And we all know in this profession that our officers, they hate the status quo, but they hate change. And so when it proves out, right? When it proves out and it's there, that's when they find value in it.
And we definitely utilize our fire and EMS folks too. I mean, sometimes if, in the instance of somebody who's just attempted on their life and they're with injury, that's now a medical concern. There's not really a point of taking the time for an assessment then because they need emergent medical care. So, we definitely collaborate with our fire and EMS professionals, and they may get called to the scene to maybe just check someone's well-being for their physical and medical symptoms they're experiencing, and maybe that person's good to go and we continue on with them and we're able to clear medical and fire. But there's times where it may be absolutely necessary for, this person needs to get on the ambulance and get to the hospital right away.
Let's take a break for a minute.
Yeah.
Safe Haven Defense, preserving property, protecting lives, providing peace of mind.
How long has your program been up and running?
Since 2019.
Okay.
And Holly, how many cases are you guys managing on an annual basis?
That's actually a good question. I don't know the annual numbers. Okay.
So between 4 case managers last year, they had about 1,300 case management interactions.
Wow.
And then we had about as many crisis calls. So about 2,600 calls a year is what we're seeing. We have 4.
Have you seen a reduction in suicide?
So this is kind of an interesting thing. Yes and no. A lot of the suicides that we have in our local area, whenever we look at them, they're not even from our area. Summit County is an hour away from Denver, and we are on the Continental Divide. It's kind of Colorado's playground. A lot of people will drive up from Denver to complete suicide in our jurisdiction. We've never had any interaction or contact with that person before, so any prevention work we might do kind of misses that demographic of person.
Sure.
Within our own community, yes, our suicide numbers are very low for our residents that we have here. I think in the total life of our program, out of everyone that we've contacted in the entire time that this program has been running, 2 historical clients of ours have completed suicide that we know of. So in 5.5 years.
That's a pretty good success rate.
And you got to realize we deal with very acute, reoccurring clients.
Sure.
And just for a comparison, I did a research project in grad school on suicide rates in Colorado. And when you're looking at the percentage, per capita, if you're looking at the Denver County vicinity, their suicide completion rate, when you're looking at the total deaths, this would have been from 2022, but they're at about it was 2.3%, whereas in Summit County, you would be looking at closer to 9%. And so again, just to emphasize what Guts was saying, we have so many people that come from all over that just kind of end up here for whatever reason. But, I think that looking at the folks that have engaged with our team, it's so minimal as to, further attempts and completion to that, because they continue to engage with us and that they know that support is available. I think the completed suicides that occur, a lot of those folks just may not even know that we exist, or they aren't familiar enough with the county and the program to know what help is available here.
Right. And I think probably at that point their mind is already made up, right? I mean, they're heading to you guys because it's a beautiful place to be, and that's I'm speculating, but when you look at the stress point on the sheriff's office up there, it's a huge reduction in calls, right? Of actually pulling deputies off the street, since you have dedicated people in this, right?
It
It's
is.
got,
Yeah.
it reduces that call for service, pulling a deputy away from, or an officer in one of the jurisdictions you serve, right? Pulling them off the street, allowing them to go out and do what they need to do.
Right.
I'm sure that is a huge benefit for all the agencies up there.
Oh yeah, they love us. They can hand the situation off to us and get back to things that are more law pertinent to respond to. And I think historically, when it's just a law enforcement response to a person in crisis, they have this a little bit of more of a time restraint, because they have so many other law related calls that they also need to attend to. Whereas if we take over the scene, maybe I'm meeting with that person for a few hours or half the day, depending on the circumstances. And so we have a lot more freedom as to what we can do out in the field in that moment with that person, and meet them where they're at and continue to work with them until they are stable.
Right.
I think something you can't track is the number of calls that don't happen because we're here. And,
Right.
Those calls don't even start. Or like if somebody's starting to go into crisis, they call their case manager, and that person can start to pour some water on that fire before
Prevention's always hard to manage, or hard to quantify.
Yeah. And so I think the other thing to think about is we engage these populations that we call familiar faces or high utilizers. You may have had one or two of those in Aurora. It's the person that the 1% of the population that is responsible for about 70 to 80% of the calls that you receive.
Yeah.
And so instead of them calling us every day with an emergency, we're actually calling them every day to check in before things go south. So it's this preventative piece that happens with intensive case management. And you can just watch the recidivism drop to zero as soon as they engage, if they're actually doing the work, because they have to do work too. It's not just us doing it. But if the person's engaged with us, you just watch the recidivism drop right to zero.
Yeah. So it's that whole proactive piece, right?
It is.
And I think coming back to the case management too, that's really what's so monumental to the success of, especially with our high utilizer clients. I mean, we work with them beyond the moment of crisis and continue to connect with them to make sure that support that they may need is in place, and what led them to that crisis. Maybe that's something that our case managers can work with them on, determining what barriers exist in their life to access mental health services. And our case managers, that program is totally complimentary and voluntary, and we may have folks that work with them for a few hours to a few years, just kind of depending on their circumstances. And as long as that individual is remaining in the Summit County community through work or residing here, then and they have active mental health goals that they're working on, then they can continue off and on with case management as long as they feel necessary.
Going forward, what do you see some of the hurdles are as you guys move forward and prepare? And I'm sure as calls for service rise and that type of stuff, what are some of those hurdles you're expecting to, or you are currently working through?
Yeah, I think one thing that probably a lot of people in any community face is getting people to higher levels of care, mitigating barriers to treatment, finding bed space for somebody that needs help. It still is not an easy process. I didn't really talk about this part of our program, but there's a segment of the population that needs mental health help, and it's not short term. It's usually a mid-tier kind of week or two to get stabilized. We across this country kind of have a revolving door program where law enforcement will pick somebody up, complete an assessment, take them to the hospital. The hospital releases them. They go back into the street. We contact them again because they haven't gotten the treatment to address the issues. They've only kind of put a Band-Aid on it enough to where the person's not actively going to complete suicide or harm someone else, or maybe they haven't even reached that point. But kind of this revolving door. There's a piece that and a place to fix that, and that's usually through voluntary treatment or involuntary commitment. And so someone that is experiencing repeated incidents over and over and over, we can get them help, but it's a matter of limited bed space. You can only do that for so many people at a time in this entire state. We're talking, maybe 1,000 beds at the most, probably not even that, probably half that. So you can really only get people clinical treatment so many times, or so many people into that system at one time. And I think it needs to be more robust.
Do you work only with adult populations, or are you spending a lot of time with juvenile populations? Because my work has been with juvenile populations for 20 years, and Colorado reduced bed space so significantly for juvenile populations that it's just been a challenge. And wondering what your work has been like surrounding kids.
Absolutely. I mean, any individual that finds themselves in crisis, regardless of their demographic or age, we will respond to that. And I think particularly around the school year time, we definitely see our adolescents and youth folks finding themselves in crisis. We'll respond to the school at times. We have, I think, as we get into this time of year, as school's kind of been in season now for a few months, we're seeing an increase in our adolescent calls. And, sometimes there's an ebb and flow to that depending on the time of year. But I would say there's a significant number of juveniles that we work with.
I think our youngest client's 5 and our oldest was 101.
Wow.
Holy cow. And was 5, was that in the residence, or was that, I guess that would be kindergarten, or was that at the school?
It was at a home.
At a home.
But we have, as Andy said, it's kind of a mixed bag. We work with the school hand in hand a lot of times. Sometimes, with the Safe to Tell system, I'm not sure if everyone has that across the United States, but whenever school's not in and a Safe to Tell comes out regarding self-harm, that's us. And so we kind of connect with those systems in multiple ways.
Yeah. I think you all add a tagline to your business cards that just says the help and the hope, because that's really what you are.
I like that, John.
Isn't that the truth, right?
Yeah.
And so we talked about some of the hurdles. What are some of your things you want to highlight as some of your successes? And I know we probably already touched on that a little bit with our conversation, but some of those big highlights and the things that you're really proud of, to share some of that with us. Start with you, Holly. Give us something.
I guess it's just been cool to work with some of the high utilizers and watch them make progress. And progress isn't always linear, but I don't know. It's really neat to see our team just have little successes with people, and just have them know that we care. A lot of people up here are alone. They move here away from their families, and it's just been really meaningful to get to be those people that they call.
Yeah. Andy, how about you?
Well, I'd love to speak more to, some of our call outcomes. We mentioned the stabilization in place and connections to a higher level of care. And I think really emphasizing that number of stabilization in place outcomes that we're able to provide is what's really significant to our program, and having that clinician available, previously the options, for these types of calls was maybe you either go to the hospital or you go to the jail. Whereas now with a clinician on scene, we can do a comprehensive assessment and sit down with that person and go through the safety plan and the lethal means restriction, and immediately connect them to further support so that they're able to continue to thrive in their current setting without having to go to a higher level of care. Sometimes that's the most appropriate option, depending on what's occurred and what that person's needs are. But just seeing the vast number of folks who were able to, in that moment, de-escalate and create at least temporary safety for them to get through the rest of their day and into the upcoming days. And I think that's what really makes me so passionate about this line of work is just seeing how successful it is, and seeing and hearing the feedback from the community, and just the response of seeing like this is effective, this is working.
Yeah, having the opportunity every day to change a life, right, for the better. Yeah, it's pretty cool. Guts, what would you want to highlight?
I'm the statistics guy, but I'm going to shy away from that and tell a quick story that I think fits your channel very well. We as first responders are exposed to so much trauma and carnage throughout our career, and sometimes our glass gets full. My team is also the negotiation element for Summit County, and we had a police officer who was suicidal in our jurisdiction, and we completed an investigation to find that person, where they were located at. We got into a negotiation with them for about 6 hours, talked a gun out of their hand, and then stuck with that person to get them all the help that they needed in the moment. That person has made a full recovery. I don't know if we ever make a full recovery. That person has made a phenomenal recovery and is doing good work in our realm still to this day. And for me, that's one that I think back to often, like, man, this could happen to anybody at any point in time in their life. They could hit the limit and be in crisis themselves. And I'm just very blessed and honored to be the person that gets to go there and help them through those tough times.
Yeah. And get them back on that right path, right?
Absolutely. Yeah.
We all go through, this profession, like you said, your glass gets full.
Yeah.
And what we're trying to do in some of these podcasts and some of these conversations is to normalize that, hey, we can all get there. And once we understand that, normalizing the ability to reach out and get some help so that we don't get to that major crisis point, right? But even this sound like on this one here, they were at a major crisis point, but you guys were able to, get them back on the right path, which is pretty amazing work, right? It makes it all worth it right there.
Yeah, absolutely.
Yeah.
When I'm having a tough day, I think of that one, and it gets me going again for sure.
Right. Yeah. I hear you.
We've had the opportunity to talk to a lot of centurions, the protectors, on this podcast. But truly, you all are walking the centurion's path every day and protecting both those that need the help and the hope, and protecting your fellow officers. I think that is just incredible work all the way around.
Without a doubt.
Yeah.
Well, any last words? I think we're gonna start to wrap this up. I've got 12 inches of snow I need to go move.
Glad.
John said I looked like the Unabomber today, and it's like I was out plowing, and I'm going back outside plowing because, as you know, we're getting another storm tonight, and I think another storm tomorrow. So there's work to be done.
Right on.
But any last words? Anything that you want to share while we've got you?
Well, something just to touch on, with Guts' story he just shared with us, all of our team is trained and certified in crisis negotiations, including dealing with barricaded subjects and hostage situations. And so, I think that's coming back to that tie of the clinical side into law enforcement piece. Sometimes there's that overlap of mental health and maybe something criminal happening. And we're able to support our patrol and investigations unit with those types of situations too, which I think is really cool that we were able to bring the whole agency together to unify when those really intense cases come up.
Right. So let me ask you a couple questions on that, because I think that's kind of an interesting thing. So Guts, you said they are sworn, but they're not law enforcement, correct?
Right.
So,
They take an oath of office. They're
Right.
sworn through our sheriff's office. Yep.
So that brought up a question. And actually, when I was in Boston, I was talking to a few people about this. So it's interesting that she just mentioned it. As far as being on the negotiator team, are you supporting, or are you actually doing the negotiations? And if you are doing the negotiations, when it comes time for that lawful order, how are you guys managing that? How do you wade through that?
So we have a policy in place that basically, there's a primary negotiator and a secondary negotiator. One of the two must be a certified officer. Yesterday, I happened to be a primary on a negotiations call that we had. And so if it came to a point of a lawful order like that, we would just switch over to the law enforcement officer to give that.
Okay. So you navigate it quite seamlessly then.
They're working as a unit together, and so they can just pass the mic over to the correct person.
Does that, have you ever ran into some stress points where, because I know there's a lot of agencies that are trying to navigate this, so I might actually direct them your way. Do you come into any stress points when, let's say Andy's doing the majority of the negotiating, but now we're getting to that point where, all right, we've crossed this line, we're going to get into some lawful orders and some of that. Have you seen it escalate the situation with that handoff, or is it?
We had a call like that just a few weeks ago, actually, where I was involved with speaking with, reaching out to the subject, but then also heavily working with the victims. And then as we continued, this started off as a hostage barricade type of call, but then eventually it kind of transformed into, okay, well, now the victims need mental health support, and now we have this criminal element going on with the subject, and so there's often that handoff over to the law enforcement side of the response. But I think it's generally pretty fluid. I mean, yeah, sometimes it's tough to navigate when there's that overlap, because I think when you're responding with just a very straightforward law type of call, I mean, things are set up to be black and white, right? It's like, okay, this is either legal or illegal. But then when that mental health component gets blended in there, sometimes it creates a bit of a gray area. And so, I think we do a good job of gauging the scope of our practice and recognizing when something's becoming more criminal, and treating it appropriately to make sure that response is handled. And we generally, not even just with negotiations, but in general calls where there might be that law overlap, I think we do a really great job with distancing ourselves as the mental health professionals and the mental health team from patrol. So we might work with somebody, and now this, criminal piece has come up in our assessment or interaction with that person, and we don't do the arrest though. So patrol will take over and we'll separate ourselves from the scene, and then we're not able to be negatively associated with that arrest and whatever becomes of that.
Talk about a force multiplier for a small community where resources, we're resource driven, right? And to be able to utilize that type of skill set, most departments, I don't think are anywhere near what you're doing. And I love the fact that you're being so creative and thoughtful in that approach of, how to make those transitions happen. But how to use your resources to really leverage de-escalation strategies. I would assume, your use of force, numbers have dropped over the years also.
Our unit specifically has had 0 uses of force and 0 arrests in 5 years.
Wow.
That's awesome.
Wow.
And it goes back to, in some of those conversations on this negotiator part, was what we talked about earlier, are those silos. Instead of just being on a level playing field and let's say, okay, let's do what is best. Let's use the person that is trained to do this and utilize that skill. some of these places where we're holding on to silos, this is the way we've always done it. So we want to continue to do it. Right. And so you guys really are some pathfinders. I think it's really cool what you guys are doing and what you're kind of how you're moving forward. It's exciting, you know.
Very
If I
cool
was-
stuff.
If I was going to close with anything, what I would say is I do think there's value to programs like this. And we've helped to start programs all across our state. I give whatever we have willingly to law enforcement officers who are interested in this topic, and they could reach out to us. We'd be happy to help you talk through a program.
Well, I'm certainly going to refer at least the person that I just had this conversation with last week. I'm going to refer him to you, Guts, and
Cool.
And we, how long have you and I known each other?
I'd say 15 years.
Yeah.
Yeah.
Right? Those were good days going up there
Yeah.
doing some training and
Kicked some doors in.
yeah. Right? But I'm definitely going to refer this guy to you because I think there's a lot of value in how you guys are moving forward. And like John said, as far as a force multiplier, and then again, letting the person that, this is what you do every day. It's not getting pulled to the side. It's what you do every day and utilizing that skill set. So we'll talk offline and I'll get him connected to you.
We have agencies that reach out to us like on an almost weekly basis now, inquiring about our program and how they can implement something similar. I actually just yesterday talked to someone on the phone from another jurisdiction in Colorado who was interested in cultivating some type of program that's reflective of what we have in place. So it's really exciting to see that spread across the state and beyond. And, I think really this model of program is the future of law enforcement.
Yeah. Pretty cool, right? Walking that path.
Yep.
So, all right. Well, with that, I think we're going to call it. John, you want to do the toast or do you want me to do the toast? So we do a
You go
toast.
ahead. I opened. You do the toast.
All right. So we do the same toast. So I don't know if you got a glass of water, if you got something. If not, you can fake whatever it is. It'd be better if we were doing it with bourbon, but get yelled at doing bourbon at 9 o'clock in the morning. But this toast is our closing, and it goes back for thousands of years. But to us and those like us, Centurions, damn few left. Guys, thank you so much for being here. It's been an absolute honor. If there's anything we can ever do for you, please reach out. And again, I'll be referring a few people your way because I'm really impressed. And you guys, you're doing some pretty amazing work. So thank you.
Thank you for what you guys
you.
are doing for the law
Thank
enforcement
you.
community too. We appreciate you.
You bet. Thank you, man.
Have a
We'll see
great
ya.
day, everyone.